Has someone close to you been changing in ways you can't quite explain? Maybe a parent, a grandparent, or an old friend. Maybe they've lost weight without trying, seem more tired than usual, or just aren't themselves anymore. It's easy to brush these things off as just getting older, but sometimes there's something more. The truth is, when a person enters the final chapter of their life, the body doesn't usually shut down all at once. Instead, it whispers. It sends out quiet, almost invisible signs, months, even a year in advance. Signs that are easy to miss in the moment, but looking back, you realize they were there all along. Too often, families only recognize these signs when it's too late, when there's no more time to prepare, no more moments left to share. But it doesn't have to be that way. In today's video, we're going to walk through 5 gentle but powerful signs that may appear in the final year of an elderly person's life. These aren't guesses or scare tactics, they're patterns. Doctors, caregivers, and families have seen time and again. Knowing them can help you respond with care, love, and understanding, not fear. We're not here to create worry. We're here to help you recognize what your loved one might be going through, so you can make the most of the time you still have together, so you can say the words that need saying. Hold their hand a little longer. Give them the comfort and dignity they deserve. Please stay with us through the end of this video. These signs may help you not only understand what's happening, but also help you find peace, make beautiful memories, and walk this journey with grace and compassion. 1. Significant weight loss. One of the first and most important signs of entering the final year of life is unintentional weight loss. At first, it might not seem like a big deal. A belt suddenly feels a little loose. Clothes start to hang off the shoulders. The appetite isn't what it used to be. A once hearty eater now barely finishes half a meal. These changes can seem small, even harmless. Families often say, "Oh, they're just getting older." But when weight drops without trying, it's the body sending a deeper message. As we age, the body naturally changes. But when weight loss happens quickly or unexpectedly, it's a sign that nutrients aren't being absorbed properly. Muscles begin to shrink. The digestive system slows down. Essential systems throughout the body may not function properly. It's not just a matter of eating less. It's that the body can't hold on to the energy and strength it once could. This gradual decline in strength makes everything harder. It raises the risk of falling. It weakens the immune system. It leaves the person more open to getting sick. Sadly, this can become a downward spiral. Less eating leads to less strength. Less strength leads to less movement, and eventually even less interest in food. There's also the emotional side of it. For many elderly individuals, food used to be a source of joy. Now taste buds have dulled. Meals don't taste the same anymore. They don't feel hungry as they once did. When the body senses it's nearing the end, it often stops sending hunger signals. It's not about stubbornness. It's a natural part of the body slowing down. Sometimes chronic illnesses play a role too. Conditions like cancer, heart failure, or kidney disease can quietly take hold. Even depression or memory decline can reduce a person's appetite. When the body isn't getting the fuel it needs, it begins to fade in subtle ways. Many families want to help. They bring favorite meals, encourage eating, or offer protein drinks. But if the weight keeps falling despite these efforts, it's not just about calories anymore. The body is in transition. That doesn't mean there's nothing we can do. It just means our focus should shift. From big meals to soft, easy-to-eat foods. From finishing a plate to simply sharing a warm cup of soup. Hydration, comfort, and gentle encouragement become more important than portion size. If you notice someone you love losing weight, quickly pay attention, especially if they're eating less, feeling weaker, or becoming less active. This isn't just about appearances. It's the body sending a quiet message. When we listen with love and understanding, we can respond in a way that brings joy and compassion. 2. Frequent infections and slow healing. As someone nears the later stages of life, their body begins to show signs of struggling to keep up. One of the most telling signs is how often they seem to get sick and how long it takes to recover. You might notice that your loved one, who rarely caught anything before now, seems to catch every cold. A simple cough lingers for weeks. A small scratch doesn't heal like it used to. A urinary tract infection keeps coming back, no matter how well they're taken care of. What's happening here isn't just bad luck. It's a natural part of the body winding down. As the immune system weakens, it can't fight off infections the way it used to. The body's defense system, once strong, begins to slow down. Even the smallest germs now have more power than before. When an infection does occur, recovery often takes longer. Where once a short course of antibiotics worked quickly, now it may take multiple rounds. Some medications don't work as effectively. The energy needed to bounce back just isn't there. Infections might not show up in obvious ways. Instead of a high fever, they might just seem more tired than usual. They may become more confused, eat less, or seem unusually quiet. For elderly people, especially in their final year, these subtle changes can be signs of a deeper issue. Slow healing is also part of this picture. A small bruise takes weeks to fade. A minor sore keeps reopening. Cuts that used to heal overnight now take days or weeks. This is often due to poor circulation. Blood, oxygen, and nutrients aren't reaching the skin and tissues as efficiently. Without that steady flow, the body can't repair itself as it once did. For those who aren't moving much, pressure sores become a concern. These can lead to serious infections, if not carefully watched and managed. Again, it's not that they're doing something wrong. It's simply the body's way of saying, I need more help now. Watching this decline can be deeply upsetting. As a family member, it's natural to want to fix things. You might feel the urge to call another doctor or start another round of medication. But when infections and slow healing become more frequent, the goal of care often shifts from curing to comforting. That doesn't mean giving up. It means adjusting our focus. Sometimes the most loving thing isn't to fight the illness with everything we've got. It's to keep the person warm, clean, and comfortable, making sure their skin stays moisturized, helping them drink enough water, sitting beside them quietly. These gentle acts of care can make all the difference. If you notice your loved one getting sick more often or taking longer to recover, don't ignore it. These may be signs that the body is slowing down in a deeper way, and that's okay. What matters now isn't how many days are left, but how we fill those days with care, presence, and love. Because sometimes healing doesn't mean fighting. Sometimes healing means being there with open hands, a soft voice, and a heart full of compassion. 3. Cognitive confusion, or emotional withdrawal. Sometimes the most painful changes aren't physical. They're the ones that affect how a person thinks, communicates, or connects with the people around them. As an elderly person moves closer to the final stage of life, one of the clearest shifts can be seen in their mind and emotions. These changes can be especially hard for families to witness. You might begin to notice that someone who used to be sharp, witty, and engaged suddenly seems forgetful. They might repeat the same question several times without realizing it. They might lose track of time, even during the same day, or get confused about where they are even in familiar places. You may hear them struggle to find the right words in conversation, or pause as if they've lost their train of thought. What's especially difficult is when these signs appear in someone who never had memory issues before. That sudden shift can feel unsettling. But it's not necessarily dementia or Alzheimer's. Often, it's a natural result of the body slowing down, especially when the brain isn't receiving enough oxygen or nutrients due to weakened circulation. There may also be moments of clarity that come and go. 1 minute, your loved one might seem fully present, telling a story from years ago with vivid detail. The next, they might look lost or unsure. These in and out moments can feel confusing or even heartbreaking. But again, it's not something they're choosing. It's simply part of what happens when the body and brain begin to prepare for the final stage of life. Along with forgetfulness or confusion, there may be emotional withdrawal. The person may stop talking as much or stop joining in on conversations altogether. You may find them sitting quietly for long periods, seemingly lost in thought, or simply not interested in what's happening around them. This doesn't mean they don't care anymore. In fact, their love for you hasn't changed. What's happening is that their brain is processing less. Engaging in conversation can become mentally exhausting. Noisy environments may feel overwhelming. Even the effort to express emotions can become too much. So rather than try to keep up, many begin to retreat inward. Some people become more irritable or anxious. Others seem unusually calm, even detached, as though they've let go of things that once used to bother or excite them. These changes in personality aren't a reflection of how they feel about you or life itself. They're often just another sign of the brain adjusting to the body's overall decline. For families, this stage can feel like losing someone before they're truly gone. The person you know is still there, but they may seem further and further away. It's natural to want to bring them back, to pull them into a conversation, or encourage them to act like they used to. But the most loving thing you can do now is to meet them where they are. Speak to them gently, even if they don't always respond. Sit with them in silence, holding their hand. Reassure them with your presence. Let them feel that they are safe, not alone, and still deeply loved, whether or not they can express it back. If your loved one is becoming more confused, more withdrawn, or less emotionally responsive, don't ignore it. These are often early signs that the mind and spirit are beginning to let go. It's a time for patience, for tenderness, and for slowing down. And remember, even when words fade, the feeling of love does not. That quiet presence beside them, your calm voice, your gentle touch may be exactly what they need most in this chapter of life. 4. Extreme fatigue and weakness. Another powerful sign that a person may be nearing the final year of life is extreme fatigue. It's not just feeling tired after a long day. It's a deep, lasting weariness, a kind that sleep doesn't fix. You may notice your loved one struggling to get out of bed in the morning. Simple tasks like brushing their hair or walking across the room become exhausting. Even having a short conversation can feel overwhelming. Things they used to do easily now take great effort. Sometimes they stop doing them altogether. This kind of exhaustion goes beyond normal aging. It's the body's way of preserving energy. As major organs, like the heart and lungs, begin to slow down, the body shifts its priorities. It focuses only on what's essential to survive. Less energy is sent to the muscles. Blood doesn't circulate as efficiently. Oxygen doesn't reach the body the way it used to. Movement becomes harder. Staying awake becomes harder. Even thinking clearly can feel like too much. Many people in their final months begin sleeping much more than usual. They nap frequently during the day. They might drift off mid-conversation, yet even after all that rest, they still seem tired. It's not laziness. It's not boredom. It's a sign that their body is running low on energy. It's doing its best to stretch that energy out for as long as possible. There's also a silent emotional struggle that comes with this kind of weakness. For older adults who have lived full, independent lives, needing help can be frustrating. They may feel like a burden. They might pull away from conversations, stop attending family gatherings, give up on hobbies they once loved. Not because they don't care, but because they simply don't have the strength anymore. This can create a heartbreaking cycle. The more tired they feel, the more they withdraw. The more they withdraw, the less stimulation they get. And over time, this only adds to the decline. For families, it can be confusing. It's tempting to encourage them to get moving or try a little harder. We want to see them energized and involved again, but pushing them to be more active may not help. In fact, it can leave them feeling more drained and discouraged. What they really need is understanding. They need us to recognize that their energy is limited now and to help them use it in ways that bring peace and comfort. Maybe that means sitting quietly together on the porch rather than trying to go for a walk. Maybe it means listening instead of talking. Maybe it's simply offering a hand when they need to stand up without making a big deal out of it. If someone you love is experiencing deep ongoing fatigue that doesn't go away with rest, pay attention. See it for what it is. A message from the body that a major change is happening. This is a time not for fixing, but for supporting, a time to be present, not demanding. The most precious gift you can give them is not more activity, but more presence, a warm touch, a patient ear, a reminder that they are still deeply loved no matter how much or how little they can do. 5 major changes in breathing or circulation. Sometimes the body's most powerful messages are the quietest ones. In the final months or year of life, changes in breathing or blood flow can speak volumes. You might notice that your loved one's breathing has slowed down or become shallow. They may start pausing between breaths as if the body is hesitating. In some cases, the rhythm of their breathing changes completely. sometimes fast, then suddenly slow. There's a specific pattern called Cheney-Stokes. The person takes deep, rapid breaths, followed by long periods of silence. At first, these changes might seem small or irregular, but over time, they often become more noticeable and more frequent. This isn't just a sign of tired lungs. It's the body adjusting itself as it prepares for rest. The heart may not be pumping as strongly. Circulation begins to slow. Blood and oxygen don't move through the body as efficiently anymore. The entire system begins to shift into a softer, slower rhythm. One of the things families often see is cold hands and feet. Sometimes even the tip of the nose or ears feels cold to the touch. The skin might appear pale, or take on a bluish or mottled tone, especially around the fingers and toes. These are signs that the body is prioritizing its vital organs. It's drawing resources inward, reducing blood flow to the outer areas, focusing on just keeping the core functions going. You may also notice your loved one becoming short of breath, even with little effort. Just sitting up in bed or speaking a few sentences might leave them winded. They may breathe more through their mouth, or stop mid-sentence to catch their breath. It's not about being out of shape. It's simply that the lungs aren't working at full capacity anymore. Sometimes fluid begins to build up in the lungs, making it harder to breathe. This can cause a persistent cough, gurgling sounds, or a feeling of tightness in the chest. It might look like a regular cold or congestion, but in someone nearing the end of life, it's often a deeper signal that their lungs are becoming tired. Because of these changes, many people find it uncomfortable to lie flat. They may prefer to sleep in a recliner or propped up on several pillows. It's the body's way of adjusting to make breathing a little easier. For those watching, these changes can be frightening. It's hard not to worry when someone you love is struggling to breathe. But often these signs are not a medical emergency. They're part of the body's natural process of slowing down. There might not be a way to reverse what's happening, but there are ways to bring comfort. Keeping the room cool and well-ventilated can help. Using a humidifier can soothe dry airways. Offering small sips of water or gentle mouth care can ease discomfort. In some cases, medications or oxygen therapy may be used, not to cure, but to reduce distress and make breathing easier. If you see these signs: irregular breathing, cold limbs, pale or bluish skin, don't ignore them. They are important clues that the body is conserving its energy, gently letting go. And in these moments, your quiet presence matters more than anything. What your loved one needs now isn't more tests or interventions. They need a peaceful space, the sound of your voice, the warmth of your hand in theirs. They need to know they're safe, that they're loved, that they're not alone. Because in the end, the greatest gift we can give is not to fight nature, but to walk alongside it with grace, offering comfort, dignity, and love in every breath that remains. As we come to the end of this video, I want to take a quiet moment with you, not to dwell in fear, but to reflect with care and compassion. We've talked about 5 important signs: unexplained weight loss, deep and persistent fatigue, mental confusion, or emotional withdrawal, frequent infections, and slow healing, changes in breathing or circulation. These signs don't always appear all at once, and sometimes they can be easy to overlook, but together they often point to something deeper, the body gently preparing for its final transition. If you're seeing these changes in someone you love, know this: you are not alone. Many families have walked this path. It's never easy, it's never simple, but recognizing these signs early gives you something powerful: the chance to prepare, to be present, and to make every remaining moment meaningful. This isn't about giving up. It's about shifting our focus from fighting to comforting, from rushing to listening, from doing more to simply being there. Sometimes the most healing thing we can offer isn't medicine, but a loving presence, a quiet hand to hold, a familiar voice, a warm smile. You don't need to have all the answers. You don't need to be perfect. All you need is to show up with kindness, with patience, and with love. If this video has helped you in any way, or if it reminded you of someone special, please share your thoughts. Your story may bring comfort to others going through something similar. And if you haven't already, we invite you to subscribe. Stay connected with us. We're here to walk this journey together. Thank you for watching, for caring, and for being the kind of person who wants to make this time in life a little more gentle, a little more meaningful, and a lot more filled with love. We'll see you in the next video.